Hello friends, I am Dr. Sharmila Thukral, Senior Consultant Nephrologist at R N Tagore Hospital, Kolkata. I will be talking about post-transplant care of a renal transplant recipient today. As we all know, chronic kidney disease is a leading public health problem and about 7 million patients in this world at this time need some form of renal replacement therapy. Renal replacement therapy can be done in the form of dialysis or a renal transplant. Renal transplant is the best possible treatment for patients of end-stage renal disease as it gives a better quality of life and a better life expectancy. The patient can return to a near normal life and go back to his work. R N Tagore Hospital is one of the leading transplant centers in Eastern India. Here about 500 renal transplants are done every year. Even complicated cases like transplant across the blood group barrier and paired exchange transplants are routinely done here. Once the patient gets a new kidney, he has to be very disciplined and take care of the new kidney to prevent any kind of complications. The most important complication which a patient can face is a rejection. Rejections can be either acute or chronic. An acute rejection occurs generally in the first 3 months and it is generally treated if it is diagnosed early. A chronic rejection occurs over few months or years and leads to dysfunction of the graft. To prevent these rejections, the patient is given immunosuppressive drugs. These medications have to be taken lifelong by the patient every day and at a fixed time. Missing these medications can lead to rejections. The other major problem for these patients is infections. Now, as these patients are immunocompromised, they are more prone to infections like bacterial, viral, fungal. Especially they are prone to urinary tract infections, pneumonias, gastrointestinal infections and even wound infection. To prevent these infections, the patient has to maintain an unscrupulous good hygiene. He should stay away from people with infectious diseases like measles, mumps, flu or chickenpox. Also, they should not consume raw, undercooked food and food from restaurants. Now, certain medications which we give can cause an increase of weight, increase of blood pressure, blood sugar and a high cholesterol. To avoid these, the recipient has to take certain dietary modifications. The patient should avoid excessive salt in food, excessively sugary diet. Also, he should take a good protein diet. And the good protein diet can include fish or peanut butter or tofu. They also should increase the calcium and vitamin D in diet by taking skimmed milk or yogurt or cheese. Now, smoking is an absolutely no to it and they should give up smoking totally. The patient should have a regular exercise schedule and they should exercise for at least 35 to 40 minutes in a day. Yoga is also preferable and in our hospital we have regular yoga sessions for our transplant patients. In the early phase of the surgery, lifting or pushing weights, heavy weights is avoidable to avoid any kind of incisional hernias. The patient should be very regular with his follow-up and his lab investigations and follow up with his transplant team time to time as advised by his nephrologist to have a fruitful life after transplant. So I wish all my recipients a good health post-transplant. Thank you.